Thanks so much. Again, hi everyone. My name is Oscar Ibieta. Thank you so much for having me today. I appreciate being a part of this group and having the opportunity to share a little bit of Medicare knowledge. Like Melinda said, Medicare is very confusing. There are a ton of options out there, and I know people are constantly getting bombarded with mail and telephone calls, and we see the commercials, and we're just not sure, who to trust, what direction to go, what decision to make. What we do at Texas Medicare Solutions is we sit down with people and we show them all the different options that they have when it comes to their Medicare, and we help them make a decision based on what makes the most sense for that individual. And everybody's different, and as brokers, we represent many different insurance companies like Humana, United Healthcare, Aetna, Blue Cross, Blue Shield, WellCare, Amerigroup, you name it. We have contracts with those carriers. So our job is just to sit with you, show you the different options that are out there, and figure out what makes the most sense for you. Basically, we show you the menu and we help you, figure out what it is that you want off of that menu. And again, everyone's got different needs, so not every plan is, not one plan is going to make the most sense for every individual that's out there.
What? Oh.
So what I'll be sharing with everyone today is kind of a Medicare 101 presentation. It's called Medicare Made Clear, and it's kind of just general information. So we won't be talking about any specific benefits about Medicare, but we will be talking about, we will just go the general Medicare and what our options are when it comes to Medicare. I'll be sharing a PowerPoint presentation with you. Share screen mode. Okay. Okay, so what we've got here, again, the Medicare Made Clear presentation, and there we go. Now I am in the full screen. Awesome. Okay, so we'll be covering this here today. I will have some stopping points, like Sheila said, and I'll open it up to any questions if there are any. So these are the top 10 Medicare questions that are out there. So number one, what is Medicare? Who can get Medicare? Do I need Medicare if I plan to work past the age of 65? What does Medicare cover? Where can I get more coverage? What does it cost? How do I choose? When can I enroll? When can I change? And of course, how can I save money? What is Medicare? Medicare is a federal health insurance program for eligible U.S. citizens and legal residents. It's funded in part by taxes that you pay while you're working. Medicare is individual health insurance. It is not a family plan. It's not individual plus spouse. It's their individual. It's individual health insurance coverage. Medicare is not free. Like I said, it's not a family health plan. Medicare is not Social Security, and Medicare is not Medicaid. Two different terms, two different things. A lot of times we hear people get the two confused. They think that they've got Medicaid when it's Medicare, or vice versa. But you can have both. It is possible to have both. What's Medicaid? Medicaid is a state government program that helps you pay for healthcare costs for individuals, families, and children with limited income and resources. These programs vary from state to state, but they do follow federal guidelines for benefits. Again, it's an income-based program. It doesn't matter how old or young a person is, how sick or healthy a person is. It's based on your income and resources. So who can get Medicare? If you're a U.S. citizen or a legal resident, you do qualify for Medicare. You must live in the United States for at least 5 years in a row, including the 5 years before you apply for Medicare. In addition to that, you must also meet one of the following requirements. age 65 or older, or if you're younger than the age of 65, you have a qualifying disability, or at any age with a diagnosis of end-stage renal disease or ALS. Is it possible to have both Medicare and Medicaid? Yes, I mentioned that earlier. So some people are eligible to have both Medicare and Medicaid. The term we use for that is called dual eligibility. Medicare and Medicaid can work together for your healthcare costs, and you may qualify for special Medicare plans if you do qualify for both Medicare and Medicaid. Do I need Medicare if I plan to work past the age of 65? So this is something that we run into quite a bit these days. When I first got into the industry, the majority of people that were reaching Medicare age 65, they were already retired, but that doesn't seem to be the case this year. I feel like at least half of the people that we run into are turning 65 are still working, and they're wanting to know if they need to take their Medicare since they plan on working past the age of 65 and they have insurance through their employer. Really not sure what decision to make and who they can speak to about that. So that's exactly what we do. We're able to walk you through and help you make the decision of whether or not you need Medicare if your plan is to continue to work. So your Medicare enrollment options when you're working past the age of 65 may be different. You may be able to delay, or you may have to enroll at age 65. Generally, you can delay Medicare past the age of 65 without penalty if your employer has more than 20 employees. And the employer coverage has to be considered creditable coverage. Again, and if you choose to delay your Medicare and you've got more than 20 employees and it's considered creditable coverage, you will not be penalized down the road when you decide to take Medicare. And it's a big misconception. People think that if they don't take Medicare now, that they're going to be penalized down the road. It's not always the case. As long as you've got creditable coverage and your employer has more than 20 employees, you can remain on that employer coverage and delay enrolling into Medicare Part B. But it doesn't always make sense to do that. Sometimes you may be paying a lot more for your insurance through your employer than you would pay for Medicare. And that's where we come in. We sit down and kind of weigh the options, do some comparisons, do some number crunching, and help you decide if it makes sense to keep your insurance through work or to go ahead and take Medicare. Now, you do need to enroll at the age of 65 if your employer has fewer than 20 employees, or if your coverage is not considered creditable coverage. And down at the bottom of the screen that you see there, you see, what if I'm covered by my spouse's employer? So you may be able to delay if your employer-based health coverage is through your spouse. You may have to enroll. It depends on the spouse's employer and any rules the employer has around covered dependents. That's a lot of information. We don't expect people to know these things or have these answers, or even, trying to find this answer on the internet can even be a difficult task. But we deal with these things every single day. This is what we do for a living, so we know this information off the top of our head. Getting Medicare while still working, Medicare and your employer insurance can work together. If you take any part of Medicare, you'll no longer be able to contribute to a health savings account. So if you're reaching Medicare age and you decide to take Medicare, if you have a health savings account, you can no longer contribute to it. It's important to know you can't contribute to it, but you still own the account and you can still use the money that's in there. But the only thing is you can no longer contribute and grow that account. You don't lose the account. Medicare will not cover anyone but you. So consider how any dependents will be covered. What that means is if you're Medicare eligible, you're turning 65, but your spouse is younger than you and it is not of Medicare age, and you need your spouse on your group health plan through your employer, then it might make sense to keep your Medicare coverage. go ahead and take a quick pause there. Are there any questions up to this point? You can either put them in the chat or feel free to jump in on the audio. Give it a few seconds. If I don't see anything pop up, we'll go ahead and move through it. Okay. So what does Medicare cover? That's the red, white, and blue card that you've got. Medicare has two parts. It's got Part A, which is your hospital insurance. That's going to help pay for hospital and inpatient care. Then we have Part B, which is your medical insurance. That's going to pay for doctor and outpatient care. So let's talk about Part A, your hospital insurance. So Medicare Part A covers hospital stays and inpatient care, including your hospital room, care in special units like ICU, prescription drugs and medical supplies that are used during an inpatient stay, labs and x-rays, your OR, the operating room, recovering room, skilled nursing, hospice care, part-time skilled nursing for homebound after a qualified inpatient stay, and rehabilitation services after an inpatient stay. All of these things are covered by Medicare Part A, your hospital insurance. Some fast facts about Part A: it's premium free. There's no cost if you or your spouse worked and paid taxes for 10 years or longer. They break it up by quarters, so 10 years equals 40 quarters. If you meet that criteria, you do qualify for Part A at no cost. You can't be denied coverage, and it's nationwide coverage, including any qualified hospital in the United States. Coverage and costs are per benefit period, and you must be admitted as inpatient. Sometimes they will leave it as observation status, so to be covered by Part A, to be admitted as inpatient. And it provides 60 lifetime reserve days. So I know there may be some questions around the lifetime reserve days. I'm just gonna hold off on that. We can kind of get into the weeds and it can get a little bit confusing. So I'm gonna hold off on talking about the lifetime reserve days. Trying to keep things simple and easy to understand. Medicare is already confusing as it is. So Part B, again, Medicare's got two parts, A and B. A covers hospital, B covers medical. So let's talk about what Part B covers. That's going to cover your doctor's visits, including when you're in the hospital, an annual wellness exam, your preventive services like the flu shot, x-rays, MRI, CT scans, EKGs, physical therapy, occupational therapy, speech therapy, Melinda right there, PT, OT, ST, diabetes screenings, education, and certain supplies, mental health care, DME, durable medical equipment, in ambulatory surgery centers, ambulance, and emergency room services. All these things are going to be covered by Part B. So some fast facts about Part B. If you already have Medicare, then you know that there's a cost to it. And if you're on Social Security, you know that that is automatically deducted from your Social Security check. So Part A, unlike Part A, Medicare Part B does have a premium to it. So for this year, for 2021, the premium for Part B is $148.50. Now, I do know that it will be going up for 2022, but CMS, Medicare, has not announced what that cost is going to be for Medicare Part B. Whenever I do get that information, Melinda or Sheila, I'll send it over to you and let you know what the new rates are going to be for Medicare Part B. And you can't be denied coverage. It's nationwide coverage, anywhere that Medicare is accepted. And there is a penalty for late enrollments unless you qualify for a special enrollment period. Medicare doesn't cover everything. Medicare Part A and B, Parts A and B do not cover all of your cost share or all of your care. You do have some out-of-pocket costs, and there's no limit to what those costs can be. Medicare does not cover prescription drugs. We refer to that as Part D, D for drugs, prescription drugs. Does not cover routine dental, routine vision, or hearing. Doesn't cover glasses, contacts, or hearing aids. Medicare does not cover long-term care or custodial care. And there are some excess charges for services by doctors who don't accept Medicare assignment. That means that some doctors are allowed to charge more than the Medicare allowable bill amount, and they can charge up to 15% more. That's what excess charges means. Care that Medicare does not cover care received outside the United States. Where can I get more coverage? So whenever we meet with people, we sit with them and we kind of do a quick rundown of what Medicare is, and then we'll say to them, you've got a few different options. So one option could even be remaining on your group coverage if you're still working. And if you're not, then you have these two options that we're looking at here. So option number one, you can add one or both of the following to your original Medicare. So you can add a prescription drug plan, that's your Medicare Part D, and you can also add a Medicare supplement plan. We refer to them as supplements. You may see the term Medigap. These are Medicare supplements are offered by private health insurance companies like the companies that I listed earlier. And depending on what type of Medicare supplement that you choose, these will help pay some or all of out-of-pocket costs that come with the original Medicare. So if we choose to go with option number one, in addition to paying for your Medicare Part B, there are some additional monthly premiums that come along with that if you add the Part D plan and a Medicare supplement insurance policy. The other option, option two, is what's called a Medicare Advantage plan. We refer to these as Part C. So these are a combination of Part A, a combination of Part B, and a combination of Part D. They call these Part C. We just call them Advantage plans to keep it simple. It's a lot of letters flying around. When it comes to Medicare, we call them Advantage plans. And some of these Advantage plans may offer additional benefits like vision and dental coverage. Because it's the open enrollment period right now, you do see a ton of commercials, and you're getting a ton of mail, probably even getting the phone calls that are promoting these Medicare Advantage plans, and they're promising you the world. They want to give you free this and free that and all kinds of dollars towards all kinds of things. What they don't tell you is, what the qualifications are for those benefits that they're promoting on the TV. So I always tell people, what it is they're out fishing and they're throwing bait out and they're trying to get you to pick up the phone and call them. The only problem is you're calling an 800 number and you may be talking to someone who's in another state like Illinois or Wisconsin. And now you're dealing with somebody who is a salesperson. They're trying to sell you something and they're not familiar with, with you as an individual, and they're not familiar with the market here. And so what we do is I always tell people it's always good to meet with a local representative, whether it's with us or if you work with someone else locally, just to sit down and look at those options and really kind of help you understand, if you qualify for any of these benefits, and just kind of taking the time to review your benefits from year to year, because plans do change year over year. So the benefits that you have now in 2021 may not be the same for 2022. They may improve or they may not. So you want to take the time to sit with someone and just review your plan and see if your plan is still the right option going into next year, or seeing if there are other options going into the next year. So let's talk about Part C, Medicare Advantage. So this is another way to get your Medicare benefits. It's an alternative to original Medicare. And If you go with the Medicare Advantage plan, you're still in the Medicare program. You're not dropping your Medicare. Benefits are administered by the plan and these benefits are offered by private insurance companies. Most of these plans do offer built-in prescription drug coverage, and they may also offer some additional health benefits like dental and vision, dental, vision, and fitness benefits, and many other extras. All Medicare Advantage plans do have to cover everything that Medicare Part A and B covers. So by choosing a Medicare Advantage plan, you do not lose or miss out on any benefits from Part A and Part B from what we refer to as original Medicare. These Advantage plans have to cover everything that Part A and Part B covers and more. So keep in mind, these plans they have a contract with Medicare, and Medicare pays them to put together a benefits package for you. And most of these plans are going to cover prescription drugs and may have some extra benefits. Depending on which plan you choose, those extra benefits are going to vary from one plan to the next. So different types of Medicare Advantage plans. There are so many different types. There are HMOs, PPOs, point of service plans, special needs plans, people who are, earlier I used the term dual eligibility, right? People who have both Medicare and Medicaid. These are going to be your dual special needs plans. Then there are chronic special needs plans. There are plans out there that are designed for people with chronic conditions like diabetes or congestive heart failure, who have had any kind of bypass surgery. Maybe you've had a stent put in, a pacemaker. That qualifies you for a chronic special needs plans that will give you more benefits. Institutional special needs plans and other types of plans. The most common types of plans that we're going to see are your HMO and PPO plans, and then your special needs plans, your dual plans, dual special needs plans, and your chronic special needs plans. Medicare Advantage. So in order to have a Medicare Advantage plan, you must have both Part A and Part B and live in the plan service area. Can't be denied coverage based on your current financial or health status, including pre-existing conditions. You may be required to use provider and pharmacy networks. Coverage and costs are going to vary from plan to plan, and they may change each year. Medicare does not have a limit, an out-of-pocket maximum limit. With Medicare Advantage plans, you will have a limit. What that does is it's there, it serves as a protection, it's your safety net in a scenario where your medical bills are really rising. You do have the protection of having a limit as to how much money can come out of your pocket. Some of these plans may have a monthly premium, and in order to have a Medicare Advantage plan, you have to continue to pay your Part B premium. Go ahead and stop there, open it up for any questions. Take a few seconds to open up the floor if anyone's got questions.
So I have one, Oscar. This is Melinda. So you did say Medicare does not apply outside the United States. So if we've got a retiree who wants to retire in like Puerto Rico or Hawaii, those are covered, right? Medicare.
Yes.
But if
yeah, that's a good question.
Yeah, so
they would still be able to.
Sorry.
Go ahead.
Yes, but if they decide to go to, like, we see a lot of expats living in Belize and Costa Rica, that's not going to be used, right? Medicare.
Correct. Yeah. So it's only going to be, it only offers coverage in the United States, and that includes Puerto Rico. Now, if you plan on retiring in Puerto Rico or the United States, there are Medicare plans in those places where you can enroll into either, again, a Medicare supplement or a Medicare Advantage plan. And just to reiterate what you said, if they decide to retire anywhere outside of the United States, then they will not be able to use their Medicare plan. Good question.
Thank you.
Okay, let's talk about Part D, prescription drug coverage. So Medicare Part D insurance provides coverage for prescription drugs and sometimes vaccines. So there are two ways to get Part D, prescription drugs. You can get a standalone Part D plan, or you can get a Medicare Advantage plan that includes prescription drug coverage. So the Medicare Part D plans cover types of drugs that most commonly prescribed for Medicare beneficiaries determined by federal standards. Specific brand name drugs and generic drugs included in the drug list, and commercially available vaccines not covered by Part B. So not all drug plans cover all drugs. And sometimes people assume that it's a drug plan, it's got to cover all prescription drugs. It's not necessarily the case. That's why there's a formulary, a drug list. So it's important to make sure that whatever prescription drugs you're taking, whatever plan you decide to choose to enroll into, that your prescription drugs are covered, one. And two, you want to make sure that you're saving the most money possible with your prescription drug plan. There are different tiers. All plans are tiered from tiers 1 through 5. You see the dollar signs there. So tiers 1 and 2 are your generic drugs. So you will save more money, less dollar signs there. And then tiers 3, 4, and 5 are going to be your brand name drugs and your specialty drugs. This is the donut hole or the coverage gap. This one takes a little bit to explain and it can get a bit confusing. So I'm going to skip over this one. Some fast facts about prescription drug coverage. So you must be enrolled in Part A or Part B or both. You do not have to have both A and B to have a standalone prescription drug plan. You may be required to use a pharmacy network. And then, like I mentioned, coverage and costs are going to vary by plan and they may change every year. If you don't enroll into a Part D plan when you're first eligible and you don't have other creditable coverage, there may be a penalty when you decide to enroll into a drug plan. Medicare supplement insurance. So earlier I talked about having option 1 and option 2. We just talked about option number 2. Now we're going to jump in and talk about option number 1, which is Medicare supplement insurance, or sometimes referred to as Medigap. So Medicare supplement plans, they help pay some out-of-pocket costs that are not covered by Part A and Part B. They do work with original Medicare, and they can't be used to pay for Medicare Advantage costs. So you cannot have a Medicare supplement and a Medicare Advantage plan. You've got to choose one or the other. There are 10 plans that are standardized by federal and state law. So this is where, if you've ever, looked into your Medicare insurance, specifically Medicare supplements, you see all the different letters that are out there. There's, Plan F and C and K and L and G and M, and it almost feels like it's the entire alphabet, and you're wondering, well, what do all of these plans cover? I believe there's a chart in this presentation that shows what each plan covers. Plans with the same letter offer the same benefits nationwide. So let's take the most common, the most popular Medicare supplement plan is your Medicare Plan G. G is in gamma, the letter G. The coverage is going to be exactly the same, whether that coverage is through Mutual of Omaha, a company like Mutual of Omaha, a company like AARP, or Humana. If it's a Plan G, the coverage is exactly the same. The only difference is the cost. Price is the only difference when we're shopping for a Medicare supplement plan. Your plans may help pay some of your Part A coinsurance, skilled nursing facility, your Part B coinsurance or your co-pays, any deductibles, and cost of foreign travel emergency. So Medicare doesn't cover you outside of the United States. Medicare Advantage plan will in the case of an emergency. So will a Medicare supplement in the case of an emergency. Routine care outside of the United States is not going to be covered. Medicare supplements do not help with prescription drugs. They do not help with routine dental, vision, or hearing. They do not help with eyeglasses or custodial care, or long-term care. Medicare supplement plans do not cover those things. The next slide, I believe, is the chart. Here we are. So these are all the different Medicare supplement options. So on the left-hand side, you'll see the benefit. It's got a breakdown of all the different benefits. And then as we move down the line here, plan A, B, D, G, it shows you at what percentage that particular plan will cover it at. Now over on the far right-hand side, we see plan C and plan F. So if your Medicare begins after January 1st of 2020, you are no longer eligible for a plan C or a plan F. However, if your Medicare began before January 1st of 2020, then you are still eligible for a plan C or a plan F. Big question is why. I do not know why they did this. I think what they wanted was just more cost share from the individuals. But really, I don't know why they removed why it's no longer an option for individuals with Medicare or who are new to Medicare. So some fast facts about Medicare supplements. You have to have both A and B, and you have to live in the state where the plan is offered. There's no underwriting for up to 6 months after you enroll into Part B or at age 65 or older. So if you are new to Medicare, you just enrolled into Part B, you have 6 months to enroll into a Medicare supplement with no questions asked, no underwriting. If that 6-month window has passed, let's say you've had Medicare for 3 years now, and you'd like to get a Medicare supplement, you would have to go through medical underwriting and you can be denied or accepted. It's a little bit like a life insurance policy. They can choose to accept you or deny you. It's nationwide coverage. There's no provider network. As long as they take Medicare, you do have access to any doctors with a Medicare supplement. And it's guaranteed renewable as long as you pay your premiums. As long as you're making your premium payments, you can continue to have that Medicare supplement. You will see the costs go up year over year if you live in the state of Texas. Texas is an age-attained state. And what that means is, you know, if you're 65 years old and you've got a Medicare supplement, today you get the price of a 65-year-old. Next year, when you're 66, you'll have the price of a 66-year-old, and so on and so on. So as we get older, we will see the price of your Medicare supplement plan go up. You're not locked in at that rate for life. And of course, you still have to continue to pay your Part B premium to have your Medicare supplement. So how much does Medicare cost? Well, I mentioned earlier the cost of Medicare, it's $148.50 for Part B, and your Part A is premium free. So we're talking about, so let's define a few terms here. So premium, this is a fixed amount that you pay for coverage, and it's usually monthly. Deductible, it's what you pay before your insurance starts to pay. Copay is a fixed amount that you pay at the time that you receive a service. The simple example there, you go and see your heart specialist and you pay a $25 copay. That's a fixed amount. And then we have coinsurance. This is an amount that you pay when the plan splits the cost of a covered service with you by percentage. So coinsurance is percentage. The most common one that we see, 80-20, right? The insurance will pay 80%. Your coinsurance is 20%, your portion, your contribution, your percentage. So costs that you, so Part C, Part D, and Medigap plans. So the plans will vary in the costs that they choose to include and how much. So with Medicare Advantage plans, Part C, you have a low to zero monthly premium, but you may have a deductible, you'll have copays, and you'll have co-insurance. With prescription drug plans, there's a monthly premium, deductible, copays, and co-insurance. And then depending on what type of Medicare supplement plan, there's going to be a premium, a deductible, and possibly some copays. So how do I choose? All right. So here we are again, kind of back to the option 1 and option 2 chart. So you've got the card on the far left-hand side, the red, white, and blue card. You've got Part A and Part B, and you're wondering, you know, what makes the most sense for me? Do I go with option 1, option 2? Option 1 is going to be the option that does cost a little bit more money, but if you can make it fit your budget and it's the right fit for you, it's a great option. That's, again, having your original Medicare, adding a prescription drug plan, and adding a Medicare supplement plan. And then the other option is option number 2, which is a Medicare Advantage plan, which is your all-in-one plan, combination of A, B, and D. This is kind of a side-by-side comparison charts and things to consider. So we have our Medigap, Medicare supplements, and then we have Medicare Advantage plans. So for coverage, Medicare supplements are going to pay some costs that are not paid by original Medicare, but they don't help with drug costs. You get nationwide coverage, and they may or may not offer some additional value-added services. Now, as far as coverage for Medicare Advantage, up on the far top right-hand side, coverage for Medicare Advantage provides benefits of original Medicare and beyond, usually include Part D coverage. It may have a network, and they may offer additional health benefits like dental, vision, and hearing. Now let's talk about cost. For a Medigap, a Medicare supplement plan, they do have a monthly premium, and then you have to add a prescription drug plan as well. So you'll have a premium for your supplement, and you'll have a premium for your prescription drug plan. Your out-of-pocket costs are going to usually depend on the plan that's chosen. Usually you have low out-of-pocket costs, but you do have a monthly premium. For Medicare Advantage plans, we're on the right-hand side. They may charge a plan premium. Most plans do not have a premium. There's often no additional premium for drug coverage. It's included with the plan. And you will have some copays and co-insurance for most covered plans with an out-of-pocket maximum. So Medicare Advantage plans work a lot like your traditional health insurance. You're going to have a copay if you go to the doctor, but they usually don't have a monthly premium. Convenience, let's talk about that. With Medicare supplements, it's multiple plans. So you've got your Medicare, you've got your Medicare supplement, and you've got your prescription drug plan. For Medicare Advantage, it's an all-in-one plan. When can I enroll? So we have the initial enrollment period, what we call IEP. So to enroll into Medicare, you have the 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after your 65th birthday to enroll into Medicare. Now let's say Mr. John Doe turned 65 this past April, and he never enrolled into Medicare, doesn't have any other health insurance through his job, and he missed the boat. He didn't know that he was supposed to enroll into Medicare. He was very confused, and so he just took no action whatsoever. But he knows it's open enrollment, and so he reaches out to me and says, "Hey, Oscar, I turned 65 in April, but I never enrolled into my Medicare. Can I do that now?" And the answer is no. He's going to have to wait until the general enrollment period, which is what we see here. The general enrollment period is from January 1st through March 31st, which is what you see on the far left-hand side. So we can enroll him into Medicare during the months of January, February, and March, but his coverage will not begin until July the 1st. That's just a Medicare rule. I don't know how they came up with that rule or why. Talked about the Medicare supplement. Okay, so if you're still working past the age of 65 and you are deciding, if you're getting ready to retire, or you maybe get laid off or force you into early retirement, you have 8 months after you stop working to enroll into Medicare, which is with the top bar that you see here. We've got 8 months to enroll into Medicare after you've stopped working. Next one, late enrollment penalties. So if you don't enroll into Medicare when you first qualify, when you're first eligible, and you don't have other creditable coverage, there is a penalty of 10% for each full 12-month period that a person goes without Medicare. If you have questions about the penalty, or you're wondering if you pay a penalty or may be facing a penalty, I'm happy to answer those questions kind of on an individual basis, just because, again, it can get a little bit confusing when we start talking about penalties for Medicare. When can I choose my coverage? So that is now. The Medicare annual enrollment period, which runs from October 15th through December 7th. That's where we are now. So this is a time of year that you can join, switch, or drop a Medicare Advantage plan or prescription drug plan, or you can switch from original Medicare to a Medicare Advantage plan, or vice versa. You can switch from one Medicare Advantage plan to another, or you can apply for a Medicare supplement insurance plan during this time as well. So this is a time to review your benefits, look at what your current plan benefits are for this year, and see what they're looking like for next year. In January, we're going to have what's called the Medicare Advantage open enrollment period. This is also from January 1st through March 31st. So let's say you make a change to your Medicare Advantage plan right now during the annual enrollment period. Let's say you have United Healthcare, and your friend tells you that you've got to try this Humana plan. And January comes around, your Humana plan kicks in, and maybe it turns out that one of the drugs that you were taking is not covered by this Humana plan. During this Medicare Advantage open enrollment period, the first 3 months of the year, you have a one-time opportunity to make a change to your plan. So if you want to go back to the coverage you had before, or just look at a different option, you can do so. Special enrollment period. So qualifying life events, right? If you move from Austin to San Antonio, or if you retire and you're going to be losing your health coverage through your work, you have what's called a special enrollment period. So a lot of times people think once you make a decision now, you're locked in for the rest of the year. That's not always the case. There are some special enrollment periods that may be able to give you an opportunity to make a change to your plan. How can I save money? So just kind of some helpful tips, right? You want to use preventive services. You want to stay in your network as much as possible. Ask about generic drugs or lower tier prescription drugs. And I can't emphasize this enough. A lot of times people will choose a drug plan or just take whatever drug that their doctor prescribes them. Maybe it's a very expensive drug, and they don't know that they have the option to maybe see if there are some generic drugs out there. So just ask your doctor, if there are other options as far as lower tiered prescriptions. Great question, Sheila. Sheila asked, if you have TRICARE and Medicare, do you also need to get Part D? No. So TRICARE for life and Medicare, you're essentially covered at 100%. So whatever Medicare is not paying for, TRICARE is picking up the rest, and TRICARE also includes drug coverage. So you do have coverage for your prescriptions. So the only reason that a person with TRICARE would consider a Medicare Advantage plan, it would be for those extra benefits, because TRICARE doesn't cover dental, TRICARE doesn't cover vision benefits. Some people want that gym membership. Some people want that over-the-counter catalog. You do have the option to add a Medicare Advantage plan to your TRICARE coverage. You don't lose your TRICARE. You're not dropping your TRICARE. You're not saying, hey, I'm going to leave my TRICARE and get on this Medicare Advantage plan. It's all included. You'll keep your TRICARE coverage. And again, you just get those extra benefits that are offered through a Medicare Advantage plan. There are some financial assistance programs. So the Extra Help program that helps pay for prescription drugs. So if your income is under $1,630 a month for an individual, you may qualify to get some assistance paying for your prescription drugs. Then, of course, we talked about Medicaid. So you do have to apply for Medicaid through the state of Texas, and they will let you know whether or not you can qualify for some additional financial assistance. Medicaid, applying for Medicaid is called the Medicare Savings Program, and that will help pay your premiums for your Medicare Part A and Part B, and even possibly get you qualified for Medicaid. And then the PACE program, the program of all-inclusive care for the elderly. So call your state to see if you may or may not qualify for any of these things. And of course, if you'd like to know if you can qualify for Extra Help or for Medicaid, we are able to help with that. So where can I go for help? I know that Sheila's going to be sharing this, but you can visit MedicareMadeClear.com. You can sign up for the newsletter, and you can view more Medicare topics and articles brought to you by Medicare Made Clear at the website here. And that brings us to the end of our presentation. Go ahead and stop sharing here.
What's his name?
Stop share. I think they see something in the chat here. All right, so there's a question. If you have an Advantage plan, can you get a Medigap plan to help pay the 20%? So the answer to that is no. You cannot have both a Medicare Advantage plan and a Medicare supplement plan or a Medigap plan. It's got to be one or the other that you'd have to choose. Thanks for that question.
I have a follow-up on that one, but if the patient has Medicaid, a secondary, Medicaid can help pay for the Part B, is that correct?
Yeah, so if you have Medicaid, then your Part B is being paid for, and your cost share is also being covered by the state, by Medicaid. So there's no need for a Medigap plan, a Medicare supplement plan, if you have Medicaid, because whatever Medicare is not paying, Medicaid is coming in and picking up the rest.
Okay.
Including the premium for Part B.
So for someone who has a lot of prescriptions or does a lot of physical therapy or therapy or doctor's appointments, would Medicare be more beneficial so that they can get the secondary to help pay the 20% that a Medigap would?
Did you mean Medicare Advantage or?
Well, if they had the traditional Medicare, they would be able to get a Medigap that would help cover the 20%. Is that correct?
Yeah. So they can get a Medigap policy, the Medicare supplement. The only thing is, if they don't get that Medicare supplement policy, within the first 6 months that they first qualified for Medicare, and they want that Medigap policy, they've got to go through underwriting. So they can be denied coverage for that Medigap policy. It's not guaranteed that they're going to qualify and get accepted to have that Medicare supplement policy.
Okay, and I have somebody that wants to, she wants to know if she's an adult now, but with a disability, can she qualify for her father's TRICARE as a dependent?
So TRICARE, I do not know a lot about. That would definitely be a question directly for TRICARE, because it's military insurance. They'd probably have to reach out to them and see if there's a possibility of qualifying or getting onto that plan through her father.